I'm Julie Barkey with Session Update. The 7-member board tasked with the creation and operation of the Health Insurance Exchange was introduced today. Governor Mark Dayton led a news conference to discuss the selection of the group to the MNsure board, and several board members gave their perspective on the task they are now challenged with.
Very excited to announce the members of the Healthcare Exchange Board, now known as MNsure, the MNsure board, and which is by statute is the Commissioner of Human Services, Cindy Jessen, and 6 others. We had 112 applicants for those 6 positions, and we could have had a board 3 or 4 times this size with superbly well-qualified individuals. So we were looking for a geographical diversity, a diversity of points of view, people with extensive experience in healthcare in various respects who bring that experience as well as their expertise to the board, and they know that it's going to be a very significant commitment of time, a very challenging situation. There have been reports that the expectations that especially out in Washington, the federal exchange is lagging behind ours in terms of its development. So we're on the one hand farther ahead, the other hand we're also on the cutting edge of this, along with Maryland and Washington State. We're really the 3 states that are most advanced and beyond what the federal government itself is doing.
One of the things that I can bring to that decision-making process is having seen people struggle through all kinds of different, coming from all kinds of different places to try to figure out how they're going to take care of their health care, bills that seem insurmountable, social situations that seem impossible. And what I think is really critical is to use that experience to make sure we have products, access, assistance to help people get to the places that they need to go as individuals. So we need to really address the diversity of needs in the state and have products that are going to be appropriate for small businesses, for people in public assistance of a variety of kinds, and for individuals who are looking for how do I figure out what kind of insurance I can get. And another big thing is using this forum to get the information out there so that people know about it and will use the service, because I'm really excited about what this can do for the people in the state who've struggled trying to find a way to provide their own health care.
It's not just what insurance program is out there, but it's the communication, it's the education. That's the whole point of the exchange, is to do more than just provide a mechanism to purchase insurance, but to help the population understand it so they know what fits them and fits their unique situation. And there's going to be bumps along the road. Now, you don't expect us to come out of the gate with everything perfect the first time, but that's what we're here to do, is to, Thompson as well, and has spent time as an entrepreneur, and he understands you throw something out and you iterate and you iterate and you iterate until you get it right, and we're committed to making it right.
I've run across people who lost their jobs in their 50s, early 60s, are not yet eligible for Medicare, scrambling to try to find how to make healthcare affordable for themselves. And in the rules in the individual market, folks, older people pay the highest premiums. That's just the way it works. And MNsure is going to provide an opportunity for affordable healthcare premiums without multi-$1,000 deductibles for a whole bunch of these folks in their 50s and their 60s. And you start to meet with regular citizens, average citizens, and the number of people who are going to be touched by what we do, I think, is phenomenal.
As a health director for tribes, I spent a lot of time with tribal leaders and other health directors in other states. And I was telling the governor last week, I was at a consultation conference with tribal elected officials and health and human services directors from Wisconsin. And I was on a panel and I was explaining all of the things that Minnesota was doing. And I could see the faces of the Wisconsin tribal leaders just get longer and longer. And the disappointment was just easily readable. And no Medicaid expansion, no chance for a basic health plan, no state-driven insurance board, no chance for tribal sponsorship. And so I really felt sad about their discouragement, and I think their bitter disappointment. And so I wanted to say something that would give them some encouragement or at least some empathy. And about all I could come up with was, now you know exactly what it feels like to be a Minnesotan at the end of the football season.
The board will begin training in just a few weeks, and MNsure is expected to be online by October of this year. And Senate Media Services can be found online as well. You can follow us by following our Twitter, our Facebook, and our YouTube accounts.